Welcome to the Low Back Pain Lifetime Elimination Program. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. So by now, at this point in your progression, you should be feeling almost 100%. The biggest thing for you now is to find out what level of stability or sustainability do you have with completing those exercises, particularly videos 4 and 5 throughout the remainder of the next few years. And I say years because you're going to want to be able to progress those as you go along, add a few things, a few variations to those exercises to maintain this lifelong ability to stay away from injury and stay within health. The biggest breakdown that we see with anyone fighting low back pain is the fact that they'll do a pretty good job early on of staying healthy, of doing their exercises, but then they go back to the previous lifestyle, whatever they were doing before that wasn't allowing them to make those deposits into their bank of health. So then what happens is they have a backslide, they have another injury, another episode, and the whole thing starts over again. What we want to be able to do is develop some kind of pattern, some kind of consistency, whether that's with already existing exercise habits or programs you have, or something that you want to start new. Hopefully we've been able to establish that discipline going forward. And if you notice, it doesn't take long. 20 to 30 minutes a few times a week is all that you're going to need to be able to sustain these kinds of activities so that you can keep your back as healthy as possible. The purpose of today's video is to help you see how in real life, our real life movements, that sitting posture, standing posture, bending mechanics, how we can incorporate all those exercises we've gone through and how they then translate into real life. And so what you're going to need today is a hard back chair, like from a kitchen or floor or whatever else, some hand towels, any kind of hand towel from a bathroom, sometimes maybe 2 depending on your back, because I'm going to show you how to use a lumbar support. Very, very popular, very common, and they do have some strategic purpose. However, I see a lot of folks using them incorrectly, so I want to go over how to use those correctly to properly support the lumbar spine without causing more issues, because it is very effective as we sit or drive for long periods of time to help stay out of those postures or positions that make those withdrawals from our bank of health. The purpose of this next segment is to help demonstrate to you how to sit properly. I know it sounds ridiculous. We're teaching you how to sit, but very important, especially in terms of spinal health and long-term spinal health, there is a way to sit wrong. And especially when we start talking about using lumbar support, a lot of cars today come with built-in lumbar support. A lot of that really isn't all that meaningful or helpful until you understand what it's supposed to do and how it's supposed to fit you. And here's some tools to help you be able to assess whether it's effective for you and how you can make it more effective for your specific case and your specific build or fit. What you're going to need is some hand towels. I have 2 because it does depend on the chair that you're sitting in. This is a firm back chair. Sometimes just 1 will do. And so what we'll do is fold it hot dog style and then roll it up. So it's fairly thin or small. And what you're going to want to do is find in your low back, our spine has an S curve, they call it. Right? So in our low back, it kind of curves forward. In that mid back, it kind of curves out. And where we want this to sit is we want this to sit just below this outward curve or bulk of our mid spine or thoracic spine. So often people will say, oh, lumbar spine, lumbar support, I'm going to put it right in my lumbar spine and fill that arch that is there. That's one way to do it, but I find it to be much less effective because while it does encourage you to be in a better position, that push or pressure in that spine usually only encourages more compression. What I like to do is put it a little bit higher, put it just below the bulk of that thoracic spine, and to find it, you have to sit back a little further in the chair. You want to place the towel just below the bulk of the thoracic spine and then sink into it. And as you sink into it, it actually elevates or lifts and supports the upper half of your spine away from your lower half. So you actually get less compressive forces on it. While that's also taking place, you have less compressive forces on that lumbar spine, you also are still getting that encouragement to sit a little bit more tilted neutrally or anterior from a posteriorly tilted position. Commonly when we sit, we sit and we fall back into this flexed lumbar spine. I can't do it with that back there, so let me show you again. As we sit, we sometimes will roll or sit where now our spine is flexed forward. And when we are constantly flexing forward, either sitting down for any kind of chair, commonly at work in an office position, we're here rolled all day long. And that forward flexion, what it does is, think of our discs like a balloon between two bricks. And as we bend or flex forward, we open up the back end and encourage pressure to push out the backside, causing, if you have annular ligament tears or bulging discs, herniated discs, all the same language to demonstrate some pressure or pull across that backside. So we want to encourage a more neutral position, even encourage a little bit of an extended position to help encourage that disc to come away from that spot. And so that's where this comes in handy. As we do so, it helps to take away pressure or produce some gapping of that disc, as well as encourage that position for that lumbar spine to sit a little bit more anteriorly, and that's going to help alleviate that pressure. So sitting posture, long-term sitting posture, you want to make sure that you are sitting as far back in the chair. Your hips, knees, and ankles are all at 90 degrees, so a properly fit chair is hugely important. 90 degrees is a right angle, so you don't want to have your feet out too far where now the knee is not at 90, the ankles are not at 90, even though the hips stay at 90. This is not good enough. Bring those feet back. So we're at 90 here, and then 90 at the ankles. We're fully supported through the chair. If we have armrests, great. Armrests also help to alleviate some pressure off our low back by supporting our upper trunk. So that's how you sit. That's sitting, doing so very intentionally to keep your back from hurting. If you're going to be, chair choice it's a big decision. It really is, especially if you work from a chair or office, because you're going to spend a lot of time there. Much like the mattress. Mattress choices are a big deal because you spend a lot of time in them. This is one of those same kind of decisions that you need to be cautious about, be intentional about what you're trying to produce as far as the angles of your body, but also support for your back. So if your chair is not as firm, as solid as this, and maybe like a car, you're in a seat where there's a lot more cushion, recliner, things like that, where there's a lot more cushion or sink to it, you might need 2, maybe even 3 that you roll up so there's a bigger bulk, and you'll feel that support instead of it being swallowed in a cushiony chair or a cushioned back chair. Vehicles, recliners, couches, all those seats that will have that kind of sinking ability, you may have to take 2 to 3 towels to roll up to create a bigger bulk. It doesn't need to be super long. Sometimes beach towels are helpful though, because those can wrap all the way around and they're easier sometimes to control or manage. So if you like a beach towel, that can also work to roll up. That actually will come to the side and you'll have a little bit more ability to fine tune the location of it. So consider that as well. Now we're going to go over standing posture and position. I've already kind of alluded to some of these techniques earlier about finding pelvic neutral and the bucket. We're going to go over those a little bit more in depth, and to help you understand and be more aware about how the position of or posture of our pelvis makes a big difference in maintaining spine health. So in a standing position, I've already mentioned the fact that standing is relative extension, meaning that in a standing position, we're already experiencing some extension into our lumbar spine. And that's okay. Our spine's meant to do that, totally normal. Here's where we get into more problems. When you wear high heels or high-heeled shoes, we get into more of an upright posture. This accentuates this anterior pelvic tipping, and that causes more shortening or compression on our low back. And so what we need to be able to do is wear shoes that are mostly flat and then level or center our pelvis. Think of it again like that bucket that's full of water all the way to the brim. If my hands are on my hips and I'm looking at how they move forward and backwards, I want to try and keep them as level as possible so that water is flat and not spilling forward or backward. Doing so, obviously we don't want to accentuate this posture position because this is very common in like a stenotic type position. We don't try and want to flex so we can be upright. We want to be here more neutral where that pelvis is level so we stay out of this posture or this position. Whenever we have an accentuated anterior tilt of our pelvis, we typically have hamstring length issues. They get really tight and then that makes it hard to bend forward. Now as we bend forward, we have to roll, and we get into all kinds of problems and imbalances through that spine. So keeping it level actually shortens the hamstrings. It allows our glutes and hamstrings to be in the proper and most optimal length-tension relationship, meaning their position now is in the best position to offer strength and stability. Instead of shortening them, from a shortened position, we're not as strong. So as we level them, we're able to get as much power and force production out of them as possible. So think about that as you stand, that we're keeping an awareness of our hips and pelvis as level as possible to maximize the productivity of our hips and glutes. So now we've talked about the exercises to help us with our bending position or bending movements. So some of the things that I want to break down for you in a little bit more depth, particularly when we think about function. We don't commonly go through all the component movements to be able to bend forward and pick things up off the ground safely. Some things I want you to be very aware of that we've worked on and why we've worked on it. So we want to think about our hip hinge. Okay, anytime we're going to go to the floor, think hip hinging, glutes and hamstrings. That's going to be our big power driver. Instead of very often what we commonly think is spine collapse and reach, that's going to put a lot more pressure across our back. Now typically it's no big deal. But in cases like you, where we have episodes of back pain in the past, we have to be a little bit more cautious because almost every single person, again, 80% of America is going to have low back pain. Almost all of them will have a recurrent episode of back pain. So how do we mitigate those chances and not take so many risks? By cutting out some of these movements and these habits that we do to cause more problems in the future. Those withdrawals from our bank of health. We want to get as many deposits in there as possible to maximize our stay or our ability to stay healthy as long as possible. So from that position, think hip hinging. Something's on the floor, we need to pick it up. We want to hinge from the hips. As we lower, our spine stays fairly straight, and then we can bend from the knees to squat to pick things up. And then as we lift, we bring everything close to us, and then we lift straight up together. If we need to bend and keep our knees fairly straight, you notice we need that hamstring flexibility, we need that glute strength, as well as our lats pulling down to stabilize that spine. This is where that thick, rigid thoracolumbar fascia comes in handy, and we're activating everything from the glutes. So everything stays active and ready to accept that load, whatever it is that we're picking up. It can be as simple as a peanut M&M. I had a patient throw out his back. He was out hiking with his kids, had one kid on his hip, went home that day, peanut M&M on the coffee table, bent over to pick it up, back goes out, and he's down for 3 days. It can be that simple. We just don't always know how simple it is that's going to cause us back pain episodes. So always think, how can I put myself in the most optimal position, in the most productive position to protect my spine? You shouldn't be afraid to bend. You should just be very aware of how to bend forward, how to lift without putting yourself at risk.